Good afternoon and welcome to this conference. If you're watching online, you have an interpreting function which you can activate with the globe icon at the bottom of your screen.
Welcome to this conference on the opportunities of created by national health data hubs and what the lessons that can be learned. We will start with an introduction in French, since this event is also organized in the framework of the French presidency of the Council of the European Union. And we will start right away with an introduction by Bruno Macquart here, chairman of the Health Data Hub, and Dominique Poiton, health economist, president of the Health Accounts Commission and of the Scientific Council of the Haute École des Hautes Études en Santé Publique. She was there at the very beginning before there was even a Health Data Hub. Donc, bienvenue à tous les deux. On va commencer.
Good afternoon to both of you. I think it can be said that there has been a data revolution in France. When does it go back to, and what are the initial highlights of this movement?
Merci. Donc, si on veut peut-être donner une date.
If we wanted to give a date for the start of this history, I think we need to understand that it goes back to a law at the end of 1998. In late 1998, a national inter-regime national insurance system was set up. It brought together all of the national insurance systems in France in a single database. This was created as a legal entity in 1998, but as you might imagine, this was a very big project, and it took a number of years before this was fully operational and usable. So it became a usable database around 2005, in particular, when the data from other systems were added in, data from hospitals and so on, and that gave us a fairly rich database. The interesting thing is that at the time, the decision was made to create this data warehouse, if you like, and at the time, many people were rather skeptical about the usefulness of this project. They thought it was a bit of a megalomaniac idea of bringing together all the data from the different insurance systems. But over time, it was proved to be a rather visionary move. A second or third key moment in this process was when a law was being drafted, a law to reorganize the health system in January 2016. In 2015, people were asking about opening health data up more widely. This was an important political moment. The discussions were held in the media, discussions were held within government, discussions were held between government and researchers and startups. There was also a parliamentary debate. This was the first major public debate about the use of public health data, and this drew on some of the work that had carried on previously and looked forward to what was going to carry out. What was the key issue at the time? Why did health data become a social issue? Dominique Poiton. As Bruno said, when it became an issue of public debate, there was a key time. I'll have to explain this a little bit for our Finnish friends who are with us. There was a particular time where there was a drug study in France, and there was a lot of debate around side effects. There were a lot of doubts about whether this drug was harmful to human health or not. And we started to use this data. It was the early days when this data was usable, and within 2 weeks it was able to be shown that there was very significant and very extensive side effects that were very dangerous for the population. Even though we had sensed that this data would be useful for a number of things, for public health and for medication monitoring, but this was a key moment when we started to see that this data could be used in the public interest, not just for the interests of the health insurance companies that had formed the system. So to connect with what Bruno was saying, this was the time at which there was a lot of demand for access to this database, and that was the start of a movement within civil society. There was a movement called Free Health Data, which became quite a strong lobbying group, saying that this data should not be available just to a few select people, but should be more widely available in the public health system. Bruno Macquart. This became a political debate because the government created the oversight of this system, decided to hand over management over it to the research directorate of the Ministry of Health, and it became a real issue for public debate and a public interest issue. Some real simple questions are being asked by people. What data is being used? What's it going to be used for? Who can these data be given to? And in particular, the issue of whether private enterprises could access this public data. So there's a balance to be struck, a balance between legitimate data protection, the protection of individual citizens, and that needs to be balanced with the public interest around the use of this data for generating new knowledge. And so we've had to invent a specific form of governance through the means of a National Institute of Health Data, which Dominique is going to become president of. So, question, what has led to the existence, the materialization of this idea of the public health data hub in France? Dominique Polton. Well, I'm not sure exactly how people see this data hub, but this idea of a hub came about from the time when we needed to bring together the public health data, which was managed by different public organisms. We needed to bring them together on a technical point of view. That was what happened through the act in 2016 that Bruno was talking about. We brought together data from health insurance system with data from hospitals that was managed by a different organization, data that was managed by a research organization that was focusing on medical causes of death. And we decided to bring them all together to make them available and to bring them together not just as a database from a technical point of view, but also to bring them together in terms of unifying the strategic governance. The ministry is now overseeing and coordinating this from a strategic point of view, but we wanted to bring them together to enable the sharing of this data, to create common rules about access to the data, what would be the procedures for access, and what uses would be allowed. So we unified all of these processes, and that's the challenge that awaits us for these even bigger databases, and that's why the idea of a hub is very important. Bruno Macquart. Just to continue what Dominique is saying, this subject was discussed in 2014 to 2016. The idea was about opening up the data. The data has been opened up. There is a issue to say that this data is not just for the government and for the social security system, but this is a public heritage, a public asset that could be used more widely. And then a few years later, it was shown that when it was working well, we could take a further step, because the president of the French Republic announced in 2018, following a report on artificial intelligence that was drawn up by a major French mathematician, Cédric Villani, he identified 5 areas in which AI should be developed. And following on from that, the president announced the establishment of a hub. He asked his government to look into this proposal, and we saw that Dominique had got involved in that right from the early stage. She was one of the 3 authors of the report. Stephanie also got involved, and she laid some of the groundwork for the system that was going to be used. And further law was voted in July 2019, which enabled the creation of the structure that exists today, the health data hub that we use here in France now. Question: what are the issues in terms of strengthening this tool that's used in health management and to turn it into something that can be used in research for artificial intelligence, for example? Bruno Maca. We can see here in this conference today that the Health Data Hub is part of a broader issue. We want to offer a large range of services for people who have projects, but we also want to encourage people to get involved in developing a shared culture around health data. There's a lot still to be done. There's some more steps to be taken. We need to structure the health data warehouses, which there's a call for projects that's just been issued, which should enable us to inject 50 million euros into the system, into the hospital system, in order to create this data warehouse. If we can go further in the future, and I'm delighted to be talking about this with our Finnish friends who are with us today, then perhaps on a European level, we're aware that the European Commission is looking at trying to develop a European health data space. The Health Data Hub organization has been nominated as a competent authority within the TEDAS system, which we'll talk further about. The Health Data Hub has worked with Findata to create a test area for this European health data space. And I'm sure this is going to be a fantastic shared story that we're going to develop together, and we'll have some further international meetings around this, I'm very sure. I would like to highlight the fact that the Health Data Hub is part of the Darwin Scientific Network. That's part of the European Medicines Agency network, which helps improve decision making throughout the drug life cycle. There's lots of things to be done. It's a small structure, but it's very efficient. It's very ambitious, is it not? Dominique Bolton. Yes, I think we're some way down the road. We've gone some way since 2005, and with the law in 2016, there was initially a system that was run by one government department and used chiefly by that same department. And now we have a tool which is used. It's a national health data hub that has brought together. It was initially some physical databases that were brought together. I think there's around 1,000 permanent access rights, but there are hundreds of projects that are based on this database. So the use of it has grown very significantly. And I think the journey that we've been able to done over, starting from a fairly limited scope, bringing together some physical databases, we're trying to go a lot further with a lot more ambition. So we're thinking about what are all the interesting data sources within France, and then not only in France, in Europe as well. There are some technical challenges around that, but I think we're facing similar issues in all the different countries. There are issues around the acceptance for people to manage this type of sensitive data. Some people in France have a sense of ownership, the proprietorial idea of the data that they've generated, but also there is a sensitive issue for citizens agreeing to share their data, their own personal data, for the purposes of the public interest. I think we need to work further on that if we are going to go further. Thank you very much. I think this concludes the introduction very well. We'll talk a bit about this further, the lessons that we can learn from the creation of these national data hubs. So thank you, Dominique and Bruno. Let's move on to our first roundtable.
And so now